As with humans, dogs get sick or injured from time to time. In some instances, illness and pain becomes apparent through change in behavior with the dog. Dog owners are very good at detecting such changes. That being said, sometimes this type of behavior can also be misinterpreted and seen as normal dog behavior. With this video, we want to give you some examples of behavior where you should react or observe the dog in case of serious illness. If you find your dog standing with his head hanging low or pushed into a corner, there is need for your immediate attention. This type of so-called head pressing could indicate a severe health issue. It's a common sign of numerous serious problems, such as toxic poisoning, trauma, or a central nervous system issue. In some cases, the dog will display other symptoms such as additional behavior changes, vomiting, diarrhea, vision disturbances, pacing, or seizures. It could be that your dog have gotten a brain tumor, which is one of the most common explanations in the case of head pressing. You should call a veterinarian right away. It's not unusual for a dog to cry and whine when he is in pain, but that's not always the case. In some situations, the dog might be isolating himself due to a mental or physical condition. So when your dog is isolating without obvious reason, it should raise a red flag. For instance, dogs can be victims of depression just as humans, and they are likely to show the same detached behaviors. Aging can also be a tough process for dogs. A lack in functions such as hearing and seeing can cause trouble in fully understanding what's going on in their environment and may lead to the dog isolating. If your dog is isolating for longer than a day, you may want to visit your dog's vet to rule out illness or injury. Keep on the lookout for signs of illness, such as vomiting and unhealthy poops. Please note that isolation also is a quite normal behavior when dogs think they have done something wrong and expect to be punished. What happened just before the dog isolated himself? Think through recent events and call the vet if you can't find any logical reasons for the behavior. Sometimes subtle changes in behavior can indicate that there is something wrong. Most likely, only you as the owner will notice these changes. If your dog is acting strange, such as suddenly snapping, growling, doesn't want to be petted, or becomes panicked when you touch him, you may be wise to call your vet to rule out underlying issues. Potential reasons for this kind of behaviors can be ear infection, digestive problems, or urinary problems. In cases of infection, your dog might be in such pain that it has an effect on his demeanor. So what can you do? In cases where the dog suddenly acts aggressively, you can try to touch his head to see if it causes fear or pain. An infection is likely if your dog shows signs like this. Subtle changes in your dog's behavior can also indicate the early symptoms of a health issue that might go unnoticed otherwise. Just remember, it's never wrong to visit the vet to figure out if your dog is in good health. Changes in food consumption can be very complex. Most dogs love food, and a good treat are often the highlight of the day. So if your dog suddenly won't eat or have other changes in their eating habits, it's easy to get worried, and for a good reason. A lack of appetite can be accompanied by weight loss, lethargy, diarrhea, or vomiting. In these instances, you should make an appointment with your vet. The causes for such a lack of appetite can be many. It could be food allergy, or your dog may experience mouth or throat pain. In rare cases, it can be cancer or a disease in internal organs. But a lack of appetite is not the only thing that calls for your attention. Even an increase in appetite can be a sign of illness. If your best friend suddenly seems to be hungry all the time or is asking for food at unusual times, it could be a sign that the dog is developing a metabolic disease such as Cushing's. Have in mind that if the dog stops eating altogether, he needs immediate medical attention. Puppies with a decreased appetite should be taken seriously, as their reserves are small, which make them more exposed to serious problems. There is nothing wrong with the dog who are circling before he is laying down or pooping. That is actually a very healthy behavior. When the dog is chasing his tail, we may just find it both funny and cute. But this behavior may not be intentional. If your dog is pacing or turning in circles without reason and is seemingly unable to stop, it could signal a deeper and more serious problem. This also applies to cases where the dog wander aimlessly or seem disoriented and confused. A neurological problem like dementia could be the cause of this behavior. If the behavior is accompanied by limping, lack of appetite, signs of pain, or pupils of unequal size, he may have had a stroke or suffered an injury to his head or neck. Even ear infection can lead to behaviors such as circling and restlessness. Diagnosis is not easy, and your veterinarian will need to do several tests to find a probable cause and begin the right treatment. Dogs tend to drink a lot, especially after exercise or on hot days. But bear in mind, if you notice that your dog is thirsty all the time without any obvious reasons, it's a cause for concern. If you notice your dog is urinating way more than usual, it could indicate a bladder problem, kidney disease, or diabetes. This may seem funny and weird, but to the dog it might actually be the opposite. It usually means that there is something irritating your dog's anus. It's not always something severe, it might just be grass or hair that has been stuck in a rather annoying place. But it could also be that your dog's anal sacs are full and need to be expressed. Also, it can be allergies or blameworms. This is an uncommon reason for the behavior, but you may want to make sure that your dog is on an appropriate parasite prevention program. Dogs expel most of their body heat from their mouths. When your dog pants, he's probably just too warm, so he's regulating his body temperature. However, if your dog is randomly panting in the middle of the night in your perfectly air-conditioned room, there might be one of 3 possible reasons for it. Your dog could suffer from pain, disease, or anxiety. In this case, it can be a good idea to rule out if there's something making your dog experience anxiety first. This is often mistaken for possessive behavior, but is most often a sign of anxiety or nervousness. Dominance is rarely the problem. Your dog is probably trying to feel safer by staying close. Anxiety is often more than a dog trainer is qualified to help with, so discuss the behavior with your veterinarian and see if your dog would benefit from a referral to a behavior specialist. No one knows your dog better than you, so trust your gut. If you notice something odd or sense there is something wrong with your dog, calling the vet is never a bad idea, even if it's just to ease your own mind. We hope you enjoyed this very brief walkthrough of potential signs of dog illness. Please like and share if you think someone could benefit from this video. And please remember, subscribe and leave a woof woof in the comment section.